Now, I myself suffer from dry eyes and dry eye syndrome, and I've been looking for a dry eye treatment that I can use at home. This is the NuLids Dry Eye Device from NuSight Medical, which helps improve natural oil production of the eyelids to help improve dry eye symptoms the day you use it and to help prevent dry eyes into the future. That's today's video. Let's take a look. Hello and welcome, this is Dr. Alan here from the Dr. Eye Health Show, helping you learn all about the eyes, vision, and finding the best vision products. If you're new here to the channel, definitely consider hitting subscribe and ringing the bell so that you don't miss any of my future videos. And at any point throughout the video, if you want to see additional information, specifications about the NuLids device or anything I mentioned, including clinical studies, I'll include links in the video description below so you can check that out whenever you want. Now again, I personally suffer from dry eye syndrome. I have what is called evaporative dry eye disease, which is the most common form of all dry eye. And that's where the tears on the surface of my eye evaporate really quickly, and that leaves all the salt content of the tears behind, which increases the osmolarity of the tears, causing redness, burning, gritty sensation on the eyes, makes it difficult for me to focus on the computer, and makes it even difficult for me to wear contacts sometimes. And about 86% of everybody out there with dry eye syndrome share this common form of evaporation. And this is usually due to something called meibomian gland dysfunction. These are the oil glands of your eyelid that are supposed to produce this thin layer of oil to stop your tears from evaporating. And for many of us, these oil glands stop producing correctly, and the oils become more like wax. And when that happens, there's not enough oils getting onto your tears to prevent that evaporation. And unfortunately, with that disease, the oils eventually solidify, become waxy, and then the oil glands can even die. And once they're dead, you can't get them back. So treating them earlier on and preventing it is going to be key. And that's where the dry eye home treatment of the NuLids device comes in. Now, this is not a sponsored video. I've been using this personally for about 2 months now, and I've been having a lot of success with it. So I really wanted to make this video and just kind of share this knowledge with you guys. Now, if you pick up the device and look at it, you'll realize it looks a lot like an electric toothbrush. But it works because it has this soft silicone tip at the front top that you replace every day, and this tip oscillates back and forth, which is used for both cleaning the eyelid as well as activating the meibomian glands within the eyelid itself. So the cleaning process helps get rid of dead skin oils, bacteria, or mites that could be living on the surface of your eyelashes and eyelids. That helps clean that off, giving you a clean, fresh new surface, as well as, again, agitating and activating your oil glands along the eyelid margin so that the oils actually start producing and get out of those glands and onto the surface of your eyelid and into your tears. Normally, these meibomian glands of your eyelid only produce when you blink and completely blink. And many of us either don't blink enough because we're staring at computer screens all day, or maybe we just don't blink completely, like myself being a contact lens wearer. That's pretty common to see. So my oil glands don't open up and release enough throughout the day. And this device, when you activate those glands, it's kind of like, at least I think of it like this, it's kind of like blinking 1,000 times in a matter of just 30 seconds. That means those trapped oils in those glands are going to be releasing into your tear film. Now, how the device works is that you only need to use it for 30 seconds on each eye every day. So that's a total of only 1 minute every day, making it super simple to use. When you use it, you have to replace the tip of the device every day with a new silicone tip. And then you're supposed to put a cleaning solution onto the tip of the device. You can use different solutions depending on what you want. In the clinical studies, they use hypochlorous acid. If you're not sure what that is, I did do a video on that in the past, and I'll hook a video link to that in the video description below if you want. Check that out to learn a little bit more. Otherwise, there's many other eyelid cleaning foams and solutions you can use as well. And again, I'll put a link to a couple of those different ones that I've used and had success with, again, in the video description below if you want to check those out. Otherwise, to use it, you have a couple of different methods. There's the direct method, where you put it directly onto the eyelid and you can pull down the eyelid a little bit or lift up on the top eyelid and you put it directly on the eyelid margin. That'll help buff out any sort of scaling or rough edges on the oil glands themselves. Or you can just do the indirect method, which is what I do, which I find just to be a lot easier, where you close your eyes and then you just put the device directly onto the edge of the eyelid, brushing back and forth so that you reach all of the different meibomian glands. And again, you do that for 15 seconds on the lower part of the eyelid and then another 15 seconds on the upper part of the eyelid. And the device itself even stops after 15 seconds, so it's easy to keep track of how long you've been doing it. So again, a total of 30 seconds on one eyelid and another 30 seconds on the other, and then you're all done. That way the device will help treat blepharitis, the buildup of skin oils, dead skin cells, and bacteria around the eyelid margin. That causes the eyes to look red, puffy, and irritated, as well as killing off any sort of Demodex mites, which can live in the eyelashes. And I have a whole other video on that if you want to learn more about Demodex, if you've never heard of that. And again, I'll put a video link to that in the video description below. But then, because of that agitation, those oil glands are going to be producing, and again, that helps treat dry eyes. Again, I've been personally using it for the last 2 months. I do keep it right next to my toothbrush so that after I'm done brushing my teeth in the morning, I can just activate the device, use it for 1 minute, and I'm done. Even when I started using it, I actually started using it both in the morning and at night because it just synced really well with brushing my teeth twice a day. Now, if you did want to read the clinical studies about the device, I'll try to include those in the video description below. But if you read that, you'll see that people had an 80% improvement in their meibomian gland secretions, resulting in a TBUT or tear breakup time score of a 60% improvement. And that's a bigger deal to eye doctors like myself. In the clinic, we always look at the tear breakup time. That's how fast the oils on the surface of the eye start to separate, and anything less than 10 seconds on the eye is significant for evaporative dry eye disease. Furthermore, the people in the studies using the device for at least 30 days ended up reporting that they were able to decrease the amount of eye drops they had to use throughout the day just as lubrication drops, and some people could even discontinue expensive medications specifically to treat the dry eye syndrome. Again, I've been personally using it for the last 2 months. I don't feel like my eyes are as dry. My eyes aren't reflex tearing when I'm staring at the computer as much. You probably noticed that yourself, where your eyes just start watering for some unknown reason. And then my contact lenses feel better throughout the day, so my eyes aren't drying out earlier in the evening, and I can pretty much wear them throughout the entire day. Now, you can usually find and purchase the NuLids device online for somewhere between $300 and $400 US. However, I have seen it as part of a starter kit for only $250 US with about a month's supply of the little silicone tips. And I think that's an affordable alternative considering for individuals whose oil glands continue to progress and get worse to the point where they need in-office treatments like myself. I've had several in-office treatments to get my oil glands pumping again because they were so clogged up. And that's important because if they do get clogged up again, they can die and then you can never get them back. And a lot of those in-office treatments, they are expensive. They can cost $600 to thousands of dollars for a single treatment, and many people need multiple treatments, and insurance doesn't cover those. So again, as an alternative to those other expensive options, I think this is very effective, and I've noticed a lot of just great improvements in general. But again, I think the people who are going to benefit the most are individuals who suffer from meibomian gland dysfunction and overall evaporative dry eye disease. Where if you're somebody who has something like aqueous deficient dry eye and you're just not producing enough of the liquid portion of your tears, again, there's different types, then this may not be the best option for you. If you yourself are not sure if you have meibomian gland dysfunction, evaporative dry eye, or exactly what is causing your dry eye symptoms, I do encourage you to reach out to your local eye care professional, get an assessment for dry eye disease to figure out exactly what is causing it, if the NuLids device is going to work for you, or if you require some other more advanced treatment. As you can probably tell from this video alone and from my other videos on dry eye, you can start to appreciate how complex dry eye syndrome actually is. If you have further questions or comments about this video, about this device, or questions about dry eye disease, definitely leave a comment in the section below. Your experiences either with the NuLids device or other treatments that you've done at home for your dry eyes, what has been successful, what has not been. I'd love to hear from you guys. Otherwise, I hope you enjoyed this video, and I hope that if you try the NuLids device, you have just as much success as I've been having. Thanks again for watching. Keep an eye on it, and we'll talk to you soon.